This is a demonstration on how to use the electronic health record for simulation patient care and simulation medication administration. You'll first choose the patient who you are assigned to and open the simulation. We will start with an explanation of the different areas that you will be responsible for to find patient information. At the top of the screen, you will notice the patient's name, their date of birth, age, weight, height. You can also access their allergy information. If the patient has any allergies, there will be a drop-down arrow and you can see what those allergies are. This patient does not have any allergies. There is other pertinent information as well, such as their code status, isolation, any food or environmental allergies, and what type of diet the patient is on. Let's begin by looking at the provider orders. So you will click on Provider Charts, Provider Orders, and you can see here the most recent orders and any older orders that you might be responsible for. You can also access the patient's history and physical, progress notes, and consultation reports as well. Under patient charting, you will find the admission history, any system assessments that you'll be responsible for, basic nursing care, charting, wounds, IVs. You can access the patient's vital signs. Over on the right, you will find the flow chart for the most recent vitals. You can also insert any new vitals that you may obtain. Under order results is where you will find the results for any diagnostic exams and any labs that the patient has had ordered. This patient has labs and diagnostics pending, but you could click on under status and you would see what those results were. Under the MAR, you will find any medications that are currently due or due in the past or due in the future. You can click on the view day here to see what day those medications are due on. Please note the date and time at the top of the chart for this simulation. For example, today is Tuesday, 8/37, so any medications that are showing here that are due would be due either 30 minutes before or 30 minutes after what is scheduled. We will go into how to administer these medications as well. Any patient teaching that should be done with that patient, their care plan, any other pertinent patient data such as their allergies, their home medications list will be here as well. You can also insert the patient's home medications, their health history, any consents or signatures that were needed upon admission. Other department forms would be located here, such as blood bank. If the patient had orders to type in cross-match, you might find the consent forms there. So now let's go in and administer the patient's medications that are currently due. So we would start by looking at the provider orders to see what medications the patient might have due. So we see we have the cefotaxime or the Claflin 1 gram IV piggyback now. We look down through the previous orders. We might also find some things that are due, such as the normal saline, morphine 2 milligrams, nitroglycerin, and so on. So now we look at the MAR. We will see that currently anything that is highlighted in green over on the right is due or can be given. We saw that there was an order for the Claflin, and there's also an order for the morphine, which I will be demonstrating today. So you click on the green button that is located on the right. Click into the patient's ID box, and there you will scan the patient's armband. For this case, you can also type in the armband number, and then you will scan the medication barcode. Once you have completed that step, you will see that it has been verified, which shows that that medication is ordered for that patient. You will come down to your administration time. Again, be sure to note the date and time that is at the top of the chart. So it is Tuesday and it is 8:40. In the comments section, you could put your start and stop time there and any other pertinent information related to this administration, and then you would put in your initials. Once you have done so, it will show that you gave that medication under dosage time. And then let's also look at the morphine to give you another example. So this is a PRN medication for pain. If this patient was in pain, we would be able to administer this within the 4 hours that is ordered. Click on the green dot, click inside the patient's ID, scan the ID, or type in the patient's ID number. Scan the medication barcode. And again, paying attention to the date and time at the top of the chart. Any comments such as start and stop time for the injection, and your initials. And again, we have it showing here that we administered this medication under dosage time.